Hi, Betsy.
Hi, Dr. Castor.
Good to see you again.
Nice to see you.
How are you?
I'm doing great. And yourself?
Good, I'm fine, thank you.
Good.
So what brings you in today?
Oh, I wanted to ask you some questions about the GPS lipo procedure.
Oh, okay.
What is different or better about GPS lipo versus traditional lipo?
Traditional liposuction is different. It's all mechanically done. It's all back and forth motion, like you've probably seen videos on TV of back and forth like a ramrod to mechanically break the fat loose that's inside of you. What's different about the GPS liposuction device is that it uses a laser to melt the fat or liquefy the fat first. And then we use a small probe to suck out the liquefied fat, but the motion is more like a vacuum cleaner, much more gentle, less pain, easier recovery afterwards. The other thing that's new about the GPS lipo device is that it uses a GPS tracking mechanism with a camera that's on the area that you want to have suction, like your abdomen, and it's watching the motion of the back and forth so that it maps where we're removing the fat so we don't take too much in one area or too little in an area. The third thing it does is it has a computer screen and it shows you the energy level of where we're applying the laser energy so that we use the laser energy evenly throughout the area of your body that's being liposuctioned, and we don't laser too much in one area or laser too little, so you'll get a smoother, more even result.
Will my skin be loose after the procedure?
No. The nice thing about this machine is it uses laser light. It heats up the collagen in your skin. We use the probe right underneath your skin to not only to melt the fat, but to heat up the collagen in your skin, and you get more skin retraction. And there's been several medical studies that have shown around 52 to 53% tighter skin with laser liposuction devices.
Is it safe?
Yes, I feel this is a very safe device. The reason being that the laser energy is being monitored by the GPS system and by a color screen so that you see how much energy is being put in each area. So it would prevent a burn on your skin because the device will shut off if you stop moving.
What is the recovery time?
The recovery time is quite less than traditional liposuction because it's a less invasive and less of the back and forth motion. Most people have a lot less pain. They have less bruising. They have less swelling. Most people feel like they worked out, like they did a very good workout at the gym. The next day they're up and around. They feel a little stiff and sore, like a workout. But most people will go back to work the next day, or at the most take the weekend off if they're doing a lot of different areas.
What will the procedure be like?
The first thing we do is give you a little bit of sedation, something like a Xanax, maybe a pain pill. The next step is to infiltrate in lidocaine, basically a dilute version of what you would get at a dentist's office to numb up the area. The second step is use a laser to melt the fat, and then the third step is to liposuction the liquefied fat out of you. Then we put you into a garment, kind of like a body shaping Spanx garment, to push the skin back tighter against your new figure, and you go home. You wear that usually around 3 or 4 weeks.
How big are the incisions that I'll be receiving?
The incisions are just a little poke hole like that, about 2 millimeters.
Okay.
Betsy, did I answer all your questions today?
Yes, you certainly did. As a matter of fact, I'd like to know when I can book my appointment.
Okay, great. I'm going to have you talk to Pam, and she will get the ball rolling for dates and costs and so forth.
Okay, that sounds great. Thank you, Dr. Castor.
Thank you.